Hey guys, how y'all doing? It's your boy David Adams coming with another dental video, and because of the title you already know what today's video is going to be about. Yes, we're talking things dental. Last time we looked at the mistakes that you and I make when we are brushing our teeth. This time we're talking about the mistakes that you make with your children, or if there's any child in your family, when it comes to their oral hygiene and visiting the dentist in the whole. So if you have a child, if you have a baby cousin, if you have a baby sister, if you have a god brother or a god sister or some child, once they're below the age of 12 years old, then this video is for you. So let's go. So the first mistake many persons make when it comes to their children and the dentist in the whole is that they're painting a very bad picture of the dentist. Come on. Y'all just overdo it sometimes. How can you tell a child, how can you look into a child's face and say, I will take you to the dentist and can pull out your teeth if you behave bad? What? You know what you're doing there? You are putting fear into the child's life, and so the child no longer wants to go to the dentist because the dentist is a bad place. And then years from now, rotten teeth. And then you know what you gonna say? Oh, he always eating sweet. Oh, I started, she know, she don't hear. She don't like to listen to me. You are the parent. You are the guardian. You are the reason for that. He or she is just a child.
It's not right for you to do this thing.
You can't be doing this thing. It is not right. So please, don't ever instill that fear into the child's life by saying you will take them to the dentist. The dentist is supposed to be a friendly person. The dentist is supposed to be that doctor that takes good care of their oral hygiene. So stop putting fear into the child's life. Choose your jokes. Normalize yourself. The second mistake that many persons make with their children and their oral health is that they are allowing your children to be brushed unsupervised. When you allow them to brush their teeth unsupervised, what you find happening is that most of the times they've swallowed the toothpaste. Now, toothpaste contains fluoride, and at the very young age, the teeth is still developing, and excess fluoride in the body can cause detrimental effects to the developing tooth. It can cause something called fluorosis. Fluorosis looks like this: mild brownish discoloration that occurs on the tooth surface because of the toothpaste that a child would have swallowed. It doesn't appear immediately, but as the child grows, you find that the tooth now becomes discolored because of the fluoride that they would have swallowed from the toothpaste. So you need to not leave them unsupervised. You need to monitor them, monitor the amount of toothpaste they are using, and also that is why there's also those different toothpastes that they would have. You know, those colored toothpastes that have those like Flintstones and cartoons and Dora kind of like thing on the toothpaste? Yeah. Those are recommended toothpastes because they have limited amount of fluoride. They have the exact amount of fluoride that is needed to help the children's tooth to become healthy and strong. So you don't give them the Colgate that we would use, because the Colgate we use have a high amount of fluoride in that toothpaste. So you give them the version for them. And since we're on the topic of brushing your teeth, the third mistake many persons are doing is that they are not checking on their children regularly. Meaning, you do not have to be a dentist to look into your child's mouth. Look into the child's mouth. Look and you'll see discrepancies. Look and you'll see things that doesn't look like it's supposed to be there. Look and you'll see things that are not looking like the tooth's actual color. You will see dark spots. You might see brown spots forming, and that is when you take the child to the dentist. However, you must regularly send the child every 6 months for checkups at the dentist so that you can know what is happening with your child's life. It's your child. You must want to know what's going on with your child, and you always want what is best for your child. So proper oral hygiene should be one of those things on the list. So please, you check into the child's mouth regularly and also go with them to the dentist for regular checkups. Hear me? I ain't talking again. Good. The fourth mistake that you are making with your children is that you are not practicing what you preach. Meaning, if you're going to tell the child, Johnny, you got to brush your teeth morning and night. Brush your teeth twice a day. If you're going to tell the child that, you need to do the same thing too. Children look at what you're doing and then they practice that. So have a time when you're brushing your teeth and let them brush their teeth with you as well, so they can realize that, hey, this is something that is good. I need to do this every single day. And then before you know it, they're brushing your teeth on their own. But still remember they must brush their teeth supervised by you until they're of age, of course, to brush their teeth on their own. The fifth mistake that many persons are making is that they are excessively giving their children sweet, like frequently. In dentistry, there's this thing called the Stefan's curve that we talk about, and it says that it's not the amount of sweet that you eat, but it's the frequency of the sweet that you eat. If you are going to give them a snack at 10 o'clock, I don't expect you to give them a snack at 10:30 and then at 11 o'clock. That's nonsense. Give them a snack at 10 o'clock and their next meal should be until 12 o'clock. And the reason for this is because with the Stefan curve says that it takes at least half an hour for the pH of the mouth, or the acidic content or the acidic environment in the mouth, to decrease or reduce back to normal. So if you continuously eat frequently 10 o'clock and then at 10:20 and then 10:30, 11, what you are doing in essence is that you're causing the acidity of the mouth to remain acidic. With the prolonged acidity in your mouth, you are more prone to caries or rotten tooth. You are more prone to other dental disorders. So it is necessary that you maintain that time in which you eat your food, because you don't want the acidity in the mouth to remain to cause other damages to your teeth. When it comes to sweet and giving your child sugary foods, I am not saying to deprive your children of sugary foods or of sweet, because I mean, come on, they are children and they like sweet. Yes, but you need to monitor the amount of sweet that you're giving them and not give them regularly. You're the parent, you're the aunt, you're the godparent. Monitor the amount of sweet that you're giving them. Nothing is wrong with a little bit of sweet. I like sweet bad. But you have to monitor the amount of sweet you're giving them and not give them it frequently. Number 6, many mothers are making the mistake by sending their child to bed with sugary foods in their mouth. Not only sugary foods, but they're also sending the child to bed with the bottle in their mouth that contains juice or porridge. Some people give their child a lollipop and then the child eats the lollipop and falls asleep with the lollipop in their mouth. That's a no-no. You don't want that happening. Here's what happens. When it comes to leaving the bottle with porridge or juice or whatever content you have in the bottle in their mouth as they sleep, and the liquid just settles there between their teeth, of course, the milk breaks down, it contains sugar, and of course it develops caries or rotten tooth a little bit more faster. And we call this baby bottle caries, and it looks like this. And it saddens me to see children and babies at a very young age with these things happening in their mouth. And it's all because the parents or the guardians do not have sound knowledge on these dental facts. We must start them from young when it comes to their dental hygiene, because if not, they grow big and then they suffer detrimental disorders in their mouth. Number 7, many persons are encouraging bad oral hygiene habits in their children. Now, when I talk about bad oral hygiene habits, I'm talking about thumb sucking. I'm talking about tongue sucking. I'm talking about grinding their teeth. These things have detrimental effects on the children after a period of time. When you suck your thumb, or whichever finger that they are sucking, it causes malocclusion, meaning it isn't in the correct alignment of the arch as it should be, like this. Instead, when they suck their thumbs and the teeth comes out of line, it becomes looking like this. And then the treatment option for this is braces. So you now have to go to the orthodontist for he or she to get braces done. And then since we run braces, listen, go to a professional dentist to get your braces done. I know I've been seeing many persons, especially in the Caribbean, going to people that are not specialized or that are not dentists to get braces done, and it looks like it is done for fashion. If you go to those persons that are not registered under the dental council and that are not dental professionals who are specialized and trained to do this type of work, then listen, your teeth will get detrimental effects after a period of time. So the minute you start seeing them sucking their fingers and their thumb, you remove it, or you put a socks on their finger, or you put bitter aloes, or you do something to prevent them from sucking their thumb. Mistake number 8, many persons are not encouraging their children to brush their tongues. They're just saying to brush their teeth. I said this in my last video when it comes to mistakes in brushing. If you did not watch it, please watch it. And again, I'm going to say, brush your tongue, because brushing your tongue is necessary. It can cause bad breath, and the tongue contains fissures and grooves that can cause plaques to accumulate between and cause halitosis. And your child having halitosis is not a good sign. The 9th mistake that many persons make is they are not monitoring what the children eat in the mornings and in the night for dinner. What you feed your children in the morning is very important. You cannot be giving the child Oreos, cookies, juice, and corn curls for breakfast. Come on, you gotta do better than that. Get up in the morning, fry some eggs, do plantains that contains carbohydrates, and the egg that contains protein. You can do sausages, and also you can give them milk, no sugar. So there you have it. Those are the mistakes that many persons make with their children, and I really hope you eradicate those mistakes so as to ensure that your child has the optimum dental health that is necessary for them to have really good looking smile. I really hope that you enjoyed this video and that you would have learned something, and that you promise me to eradicate those mistakes that you are making with your children and also with yourself sometimes. And so before I go, I just want to say thank you so much for you guys who are always watching and always supporting and liking. Just ask that you continue to support your boy thing by just liking, commenting, leaving suggestions, turning on the bell notification, and just subscribe to my YouTube channel. So until next time, bye guys. Thank you so much for watching.